Chairman. I really appreciate you having this hearing. We had a number of hearings some years ago in this Committee on Drug Counterfeiting, and it was shocking and appalling to see how serious this problem is. While we did pass that great bill last year, still I think that counterfeiting is a terrible problem that we need to address in a bipartisan fashion. As you said, counterfeit drugs can contain dangerous impurities, incorrect ingredients, improper dosages, and also have improper handling. And legitimate drugs have been diverted or stolen from the supply chain, and they've been handled improperly or stored at the wrong temperature. And then, of course, these fraudsters spend a lot of time recreating labels and packaging for the dangerous drug so that they look exactly like the real thing. I got some samples today. These are Lipitor samples, and they look exactly the same. The blister packs are the same. The pills are exactly the same. The alleged dosages are exactly the same. And if you ordered these online, you would think that you were getting Lipitor. But however, which one is the real and which one is the fake? You couldn't possibly tell, except for there's a label on the package. Here's the fake and here's the real. And this is what these counterfeiters do. They spend more time worrying about what the packaging is going to look like so it will fool the consumer, and a lot less time worrying about whether there's actual medication inside that's going to help people. We've seen a number of troubling cases recently. Criminals have tampered with pharmaceuticals used to treat illnesses like cancer and HIV/AIDS. Drugs used to treat schizophrenia were replaced with aspirin. Counterfeit cancer drugs were tainted with non-sterile tap water, and counterfeit AIDS drugs have been found to lack any ingredient. And as you said, the internet is really especially problematic for these unsafe drugs. And according to a recent FDA survey, approximately 1 in 4 Americans has purchased prescription drugs online. Most consumers purchase drugs from reputable businesses, but there are thousands of rogue internet pharmacies, some of which you couldn't tell from just looking on site, that sell drugs of dubious quality without a prescription. I couldn't believe it that you said that there was a doctor who bought these drugs online. I mean, surely if anybody should know, it should be a doctor. Now, Congress passed the Ryan-Haidt Act in 2008, and then last year, as you said, the Drug Quality and Security Act, which provide additional enforcement tools. And so I'm eager to hear from the GAO whether these laws have had an impact in combating this problem and what more can be done. I'm also interested to learn from the stakeholders and the agencies how we can increase awareness and education in the medical community and the public more broadly about the prevalence of and risks associated with counterfeit drugs. I must say, I talk to my constituents, and people assume if they're buying drugs from a pharmacy online that it would be safe. And that's an incorrect assumption to make. I think we need to have partnerships between the pharmaceutical companies, between government agencies, between nonprofit agencies, and a variety of sources to let people know how dangerous it can be to buy drugs from an internet source. And I want to commend the FDA, ICE, and the other federal agencies for their work in protecting consumers from unsafe drugs. But I also want to learn more about what we can do about counterfeiting drug activity and whether we need more authorities or stricter penalties to effectively carry out this work. Globally, the FDA works with World Health Organization and Interpol to build global capacity to monitor counterfeit drugs and to coordinate international law enforcement action. And so I know that our witness from the University of Michigan, Dr. Yadav, will talk about the global health implications of counterfeit drug activity and how existing international efforts can be strengthened. Prosecuting these wrongdoers is difficult because they're shady and they're international. But I think if we have domestic and international partnerships, we can do it. Consumers should never have to fear the prescription drug they need may actually make them sick or endanger the lives of their loved ones. And so that's why these partnerships are critical. I look forward to hearing from our witnesses and continuing to work together to make sure that when a consumer buys a drug, they know that it's going to be safe. Thank you, Mr. Chairman, and I yield back.